Thunder 102, good morning. It's Siliberto and Friends. I'm Paul Siliberto. Careful as you head out on this Tuesday morning. We do have snow throughout Thunder Country. We do have that winter storm warning in effect until 7 tonight. Updates on Radio Bold Info Central as they happen. Go to thunder102.com. Click Info Central. We're talking Garnet Health this morning, and I'm very excited now that we're heading to the Foster Supply Hospitality Thunderline. We're getting a chance to say good morning to Dr. Michael Argenziano. He is the Medical Director of Cardiothoracic Surgery, Garnet Health lead surgeon. Dr. Argenziano, first of all, good morning, and I want to say welcome to Garnet Health, to Thunder Country. And it's such a pleasure to get a chance to talk with you this morning. Good morning.
Good morning. It's a pleasure to be with you.
Tell our Thunderheads a little bit about yourself and how Garnet Health's partnership with New York Presbyterian and Columbia University Irving Medical Center came to be to bring us to this exciting point to where we're at.
Of course, yes. So I'm a cardiac surgeon. I'm Associate Chief of the Division of Cardiothoracic Surgery at Columbia University Medical Center and New York Presbyterian Hospital. And for at least 10 years or so, I've been operating on many, many patients at Columbia from the Garnet Health area because, of course, there until now there hasn't been a cardiac surgery program here locally. And I've gotten to know a lot of the doctors and so many of the patients. And one of the common themes during that time over this 10-year period has been that people. It's a rural area. It's distant from the city, and people are reluctant to come into the city for their care, and especially it can be difficult for families. So I really felt for many years now that really we ought to have a program right here in Orange County and for the surrounding counties, and that's really where the interest came. And Garnet Health has done a fantastic job. They've had this on their radar screen for a long time, and they've made it all happen. And now, since January 1 of this year, we are at Garnet, and we've been operating.
That is fantastic. And we know that Garnet Health already, a leading provider of advanced cardiac care here throughout Thunder Country, throughout the Hudson Valley. Explain a little bit to our Thunderheads how it makes heart care in our region even more advanced now, and in particular, what types of open heart surgeries are available right now at Garnet Health.
Yeah, that's a great question. It is certainly absolutely true that cardiovascular care at Garnet Health is already absolutely fantastic. We have one of the busiest catheterization laboratories in the country, which is where our cardiologists do procedures like stents and take care of all sorts of problems like abnormal rhythms and things like that. But the one thing that we haven't been able to do here is actual surgery, which are things like coronary bypass, valve repair, valve replacement, taking out cardiac tumors, removing aneurysms of the aorta, all sorts of things that people have had to go, quite a distance to get taken care of, either in the city or somewhere else. And so what we're doing now is all those operations. The other thing that this does is it actually allows our cardiologists to do even more, because there are certain procedures that you can't do with catheters unless you have cardiac surgery backup available. And so we're very excited that not only are we bringing a whole host of operations that can fix basically every part of the cardiovascular system to Garnet and to the surrounding community, but also we're helping our already outstanding cardiology teams to do even more.
Wow. We're speaking with Dr. Michael Argenziano. He is the Medical Director of Cardiothoracic Surgery at Garnet Health and lead surgeon. And Dr. Argenziano, this is so exciting because I hope our Thunderheads realize you are bringing world-class heart care right here to Thunder Country, to Sullivan and Orange counties. And there are advantages of that surgery being right here in our own backyard. And you had mentioned, that sometimes people may be reluctant to head into the city. But other than that, what advantages are there of these procedures being offered right here? And why is it that these procedures being offered so close to home are so important?
Yeah, that's a really great point. It's not just about traveling; it's about access, right? So, the people who need heart surgery are really the tip of the iceberg. There's so much cardiac disease everywhere, and especially in this area, that people need to have a place where they can come, not only for surgery, but for all the advanced testing that helps us to figure out if you have a problem, and even better than that, helps us to prevent problems from happening. So having a world-class cardiovascular center right here in the community, first of all, helps people to stay healthy, helps people to find out if they have something that needs to be taken care of. And then finally, if you do need surgery, there's no question that having the ability to have family visit, to be in your own community, to do rehabilitation in your own community, and to be close to home, in my experience, adds a tremendous amount to the recovery period. And I actually think people do better when they're close to home.
You know, that is such a good point. And Dr. Argenziano, I am speaking out of experience, because I have had some life-saving procedures through Garnet Health, through the cath lab at Orange Regional. And one procedure, I did have to go to Columbia Presbyterian to have that procedure done. And I remember what it was like there without family being there until they finally got a chance to get there. But I also realized the strain on the family to make that trip. I mean, I was put in an ambulance and taken out to Columbia Presbyterian. Friends and my son had to drive to New York City. And this is so exciting, and I hope our Thunderheads can grasp just the big picture of what you're saying and how important and exciting this is. As we wrap things up, Dr. Argenziano, I've got to ask you, if you want our Thunderheads to know one thing about new open heart surgery at Garnet Health, what would that be?
Well, what I would say is that you need to know that you right now have right in your own community not just the cardiac surgery program, but we have essentially replicated the entire program that we have at Columbia. We have built state-of-the-art operating rooms, intensive care units. We have staff that are very experienced. And I have to tell you, we have really created what I think is going to be one of the major regional centers in the country, not just in the area. And if you have any concerns or any questions, you just come and see us. You don't have to know what you need. We will make sure that you get taken care of.
That is so comforting to know. And Thunderheads, I hope you realize just the impact and how important this is and how important the information you heard in this conversation is. Dr. Argenziano, how can our Thunderheads learn more?
You can start by going to garnethealth.org on the internet, which is the general website. You can learn a lot about what we're doing.
Well, Doctor, I really happily say, once again, welcome. So good to talk to you. Thank you for your time this morning, and hopefully you and I will get a chance to catch up again soon, all right?
It's been great. Thank you.
All right. Dr. Michael Argenziano, again, Medical Director of Cardiothoracic Surgery, Garnet Health lead surgeon. And again, we are talking world-class cardiac surgery, cardiac care right here in Thunder Country, throughout the Hudson Valley, in our own backyard. It's 8:30 now. Thunder 102. Good morning. It's Siliberto and Friends. I'm Paul Siliberto.